Okay. I put this up here.
Yeah.
Okay, just put something under that. Oh, okay. Too big. Hey everyone, we are setting this up. If you can hear us, I don't even know if you can.
Can we pause?
I don't think so. And I don't even know, I don't think people can comment or anything. Oh wait, I see somebody on there. Okay, so I need a link to this thing.
Next. We are on
YouTube channel. How do I? That's funny. Where do I find a link? Share. Copy link. Okay. There we go. Sorry, just hold on 1 second.
Well, they'll just find, they just go to YouTube and do, type in Immunity Education Group. All right?
Yeah, sure.
Oh, let me get this rolling. Okay.
Okay, so just hold on 1 second. Okay, we'll just let a couple people get over here for a second.
Okay, yeah.
I'm going to just update this. Update. Thank God for your iPad, huh?
I guess so. It's going to check IG one more time. Watch, it works now. No, it's still not connected.
Okay. Oops. That's not how you spell immunity, is it?
Nope.
So, streaming. This is steaming live. Streaming. Let's not get it twisted. Okay.
Okay.
Okay, so.
All right. Well,
look at.
so
just give people a few minutes.
Yeah. Where is the camera anyway? Is it over? It's
I don't
right
know.
there. So if we're gonna
Wait,
like,
where is it? It's there?
it's on this side.
Okay.
I guess, yeah, because it's not on that side.
Okay.
Jeez. Oh wow.
Right. So, and on Instagram, I guess I should post it.
Yeah, yeah. I posted on my Instagram.
25 people have found us so far.
All right, woohoo! Excellent. Well, this will be a podcast anyway.
Yes.
As well, so.
But just can we give them 2 minutes? Well, can you just talk to people and like be very interesting?
So, how's it going, everybody?
Just be interesting and funny.
I'm gonna let Cheryl know that.
All right, I'm gonna post this. Facebook and IG live down. Moving to.
Okay, 32 people found us. Okay.
It just is going to take a second, just for everybody to get over here. Can you guys comment on here? Like, regularly?
Comment if you can comment. Yeah.
I see. Okay, so.
Okay. Well,
where? Oh, that's a comment.
Yeah.
Oh, hi.
Hi, hey, Texas.
Oh, okay. All right.
Yep.
Okay,
Yep, they can
yay.
comment. Can you, like, do a bunch of hearts and thumbs up? Let's see.
I have to check my homemade brain.
Okay. We're like huddled in now. So, okay, I think we can. All right, you ready?
Yeah, get back. What are you doing?
Okay.
Oh, okay, yay. There's some people.
Cool.
All right, well, just stop rushing everybody. It's only been 5 minutes. Just let everybody. Take a few breaths. I'm so sorry, you guys, that this is.
We lost 4 people.
Oh no. They were like, oh, never mind. These two again. Oh, it's that bangs girl. Jesus, get rid of her.
That's really funny.
Okay. Well, I don't even know if we can save this later on video. That's the only downside. Like, we're not actually recording it.
Yeah, well, we are as a podcast. I mean, do you want me to put my phone up here and record as a
maybe
video?
I'll do mine. Oh. Okay, go ahead and do yours. But then you have to send me the whole video so I can get clips from it later.
Yeah.
Yeah.
Video. Well, since you're going to be playing with it, do you want to do the video? Since you're going to be doing stuff with it?
I don't know what you just said. I wasn't listening. What?
Since you're the one going to be loading it on, do you want to do the video?
No,
Okay.
no, because you have the magnets.
Okay. Well, here is
Okay.
video. Let's turn it. You don't want a
God,
video.
you know
I
what's
want
so
a video.
funny
And
is
should I
like-
do sideways?
Yeah. Last time it was all like, okay, you're gonna get in front of them.
Okay.
Last time it was like, sorry guys, this is such an amateurish production, and we won't
And
make
this
that
time
mistake.
it really is that.
This is actually worse than last time.
Okay.
We just took 20
Okay.
minutes to find out to get into
Well,
a YouTube live
We
stream.
are ready to have fun, so.
Are we?
Right. Yeah. I know.
Okay.
Okay.
All right. Anyway.
Well, let me welcome them.
Yes.
Oh, you want
please.
you welcome?
No. Go ahead.
Okay, right. Welcome into the vaccine conversation with Melissa and Dr. Bob
What?
for another live. It was supposed to be an Instagram and Facebook live
At
show,
7:30.
and they
sorry.
found us and literally are like blocking all Wi-Fi signals from our house. So.
They shut us down.
Yeah, so we are on YouTube Live. Thanks, YouTube
We've
Live.
never
right?
done this before, so I don't know how it works, and
Yeah, we'll
that's
see.
not our fault.
Right. But you guys found us, so glad you guys found us, and
What's so funny? We switched shirts this time.
I know.
So I had censored on last
Yeah.
time. You have that on now. I have the podcast, not to show everybody my chest, but podcast tour
Yeah,
shirt
right.
happening, but it's too
Cool.
cool in here to wear it by itself.
We are
Okay, so-
3 more days into my my quarantine beard.
3 more days into mine.
Yeah.
Anybody over 40 knows what I'm talking about. Just
Oh, you're not kidding. Yeah, you're not
Stop
kidding.
it.
Right.
It's
Anyway,
called Peach Fuzz.
so well, let's jump in.
Yes. Okay. So I just want to really fast say that we did 2 days ago a first video. I don't even know where I'm supposed to be looking.
So right there's the
Yeah,
camera.
but then there's
remember?
that one.
Okay.
Okay. So I'm gonna look right in between and hope I don't look like I'm staring in space.
So this camera's there.
Okay.
Is it? No, this camera's over there.
Whoa! You should have
Oh,
looked at the
okay.
other
I
way.
should have. Yeah. Anyway.
You can do it now. You can just spin it around, can't you?
Oh yeah. Cool. Awesome
So
sauce.
we did
There.
a.
Now the cameras are next to each other.
Okay, good. So
Oh, but now I stopped it.
okay,
So
okay,
I
that's
didn't
fine.
mean
That's
to stop
okay
it.
because
Okay.
there's no time.
Okay.
So we did a video a couple days ago that has a lot of introductory stuff as it relates to the coronavirus pandemic and the panic and everything that's going along with it. So it's on my Facebook page at Melissa Floyd, and I will keep putting some video clips together. I guess we have to talk louder. I remembered that from the
Do
video.
we? Do we have to
For
talk
them,
louder, you
for
guys? Okay.
And so anyway, we're going to get right into about 4 or 5 studies today, studies and articles and whatnot. So we're not going to do any introductory stuff. So if you've missed all that, go back and check it because we're not doing it this time.
Yeah.
Okay, so we're going to get right into it, starting with the first article that was really, really interesting. And do you have the title?
I don't
Okay,
have the
so
title.
I'll get the title.
Oh no, it is.
You
It
have
is.
it on Oh, you wrote on there.
Well, it's part of the title. It's
Oh, I think I
a
have it.
fiasco in the
Yes.
making.
Yes, a fiasco in the making. This is about making decisions without reliable data. And this article was written by, I'm going to pronounce his name, John Ioannidis. I'm going to make
alright.
him special.
That
It's probably
sounds
not at all.
sounds Greek.
It sounds totally wrong,
Okay.
but Ioannidis.
Yeah. Well, why that's important is as you're reading all these articles, you want to make sure you're reading something from a credible source,
Yes.
something from someone who knows what they're talking about and should be weighing in or has the credentials to weigh in. And John Ioannidis is a professor of medicine, of epidemiology and population health, and of biomedical data science and statistics at Stanford University. and he's the co-director of Stanford's Meta Research Innovation Center. So for this kind of topic, it doesn't get, you don't get really any better credentials than that.
Correct. So I came across this article and I thought this was literally the best thing I had read on this topic, maybe 3 or 4 days ago. I thought it really summarized a lot of the things that I had been discussing with other people and we had been talking about. So we'll go through it with you and we'll put the links to these in our podcast description. Right. And by the way, times are hard and so I had to cut my own bangs today. So
yeah, you can't tell.
Okay. So no shaming, please. No bang shaming. No bang judgment. Not at this time. Things are hard enough. So if you see things like a little bit off, it's not totally my fault. Like, I'm not trained for this, okay? So
and that's tough because your bangs, that's how you bring in a paycheck, at your house. So.
Oh yeah, my huge paycheck that I have because this is so lucrative.
No, I'm in the same boat. If you saw us a few days ago, I was kind of shaggy because I couldn't go to the haircut place for like many days, and so Cheryl and we broke down, and she cut my hair last night. And it was kind of fun. It was like being back in college when your girlfriend would cut your hair, your girlfriend who's now your wife, and so it's not that bad.
Wait, do that in college? I never had somebody cutting my hair.
No, she totally cut my hair for all the first years of our marriage, and
Oh my gosh.
Yeah, well, you're poor and just out of college and medical school, and you got to do what you got to do. So that's where we are again. It's kind of fun.
Hey, quarantine life.
We had fun doing it. You can't tell, huh? I think it's.
I didn't want to say anything. So okay.
Anyway,
into the article.
Yeah.
So interesting. So
science and stuff.
Right. Science and stuff. So I'm going to start off with one of the first things that I liked, which he says, these are his exact quotes. He said, short-term extreme social distancing and lockdowns may be bearable. How long, though, should measures like these be continued if the pandemic churns across the globe unabated? How can policymakers tell if they're doing more good than harm? And we've heard the president talk about the same thing. The cure cannot be worse than the problem. And this idea about doing more harm than good. What if, everybody's like, it's just 2 weeks. And can I just say, I'm really irritated by all of the people I see online saying, watch Netflix, cook some meals with your family. It's just 2 weeks, like it's a vacation. People don't understand the kind of devastation that's happening as a result of this. Even in 1 week, you guys, like for some people, I have heard stories, people have messaged me, friends I have, in 1 week, they've lost their jobs, they've lost their business, and it's not going to reopen again. It's not like it's just 14 days, get over it. If people don't understand how businesses and small businesses work, then they don't understand why people are so up in arms about this. This is not a vacation. It's not like we're in the cabin hanging out for 2 weeks with our families. What's the big deal? Don't you want to save a life? It's just not that simple. And so that's why some of these people are having these deeper discussions about, of course they want to save lives,
Right. But I think the reality is we are in these 2 weeks. That's
we
the
are
reality.
now.
Yeah, and so.
But the issue is about how long those 2 weeks really last because there is no end date.
Right. But I think that's what everyone's pushing for now is let's get out of these 2 weeks as fast as possible.
But even President Trump said he's not giving a date.
I know.
So it's already
He's looking at Easter. Possibly,
right. It's been 9 days, but we have our own governor for our state who is making there's LA County has a lockdown in place until the middle to end of April. So that's already more than 14 days.
Yeah.
If you can't go to your work because you're not an essential business, then how are you paying your bills? They're not going to cover your bills for several months. It's just not going to work that way.
Right.
So I think if it was 14 days, we could have all been like, okay, there's an end date to this. But what it sounds like they're doing to me is a couple of weeks and then we'll reassess.
Yeah.
And then that reassessment turns into now your state's doing a month. That's extra time, and pretty soon it's going to be, it's the Easter holiday, and after that, and let's just keep kids out of school till June, and then it's summer.
Yeah,
this turns into lots of months.
Yeah, and then that's always been my biggest fear is our government going to go way overboard and turn this into many months of lockdown, or even maybe equally worse. I think these lockdown decisions are really up to the state governments. Right. And then we might have, the federal government say, President Trump might say, okay, everyone open up again. We've now realized that we don't have to have this long lockdown and we flatten the curve and so everyone can move on with their lives. But what if some states don't? And I kind of worry.
I'm worried about California.
I mean, we live in kind of one of the worst states for this kind of scenario. Right. And I envision our governor possibly keeping the lockdown going, and this becomes more and more financially devastating. And that's what this article really says. The consequences of long-term lockdowns, they are entirely unknown, and the consequences could be very dire economically, which will translate into health consequences.
Right. So he's saying, hey, this short-term thing, that could be bearable, but how long can this go on? And what if it's long-term? And if it's long-term, we don't even know what's going to happen. So
Right.
what was the next thing that you liked on this?
Well, I kind of liked they, I mean they. Let me see, where is it? Okay. Well, I like how he uses an example of the Diamond Princess cruise ship, and where we're kind of we learn, how necessary is a total lockdown, and what was the result when they had a closed space to kind of research this, and
700 passengers.
right, and they said basically the one situation and the only situation we have so far to study where there was a closed lockdown was the Diamond Princess. The case fatality rate there was 1%.
7 people out of 700.
Right, so 700 people caught it, or 700 people were on the ship.
Right, and 7 fatalities.
Okay. Yeah, so he expands more on it here. I'll go over this because this is kind of like, I found this very, very interesting. It's largely an elderly population, right? And there were just 7 deaths among the 700 infected passengers and crew. I wonder how big the crew was. Like how many,
Right.
Were on the ship. There were thousands on the ship, but out of everyone on the ship, it's not like everyone caught it. Only 700 caught it. There were 7 deaths.
700 total, not 700 caught it.
Yeah, 700. Yeah,
Oh,
700
do we know how
caught
many
it. Yeah,
were on
I don't know.
the
I
ship
don't know.
total?
I don't know.
Okay, I don't either.
Right, but 700 people caught it. 7 died, so 1% fatality. So he kind of sort of uses the numbers to extrapolate. What would that look like in the huge, like in the U.S. population if we had like a closed system? And this is a numbers guy, so he extrapolates to the entire nation. It says reasonable estimates for case fatality rate if this were to infect the U.S. population would be somewhere between 0.05%, which is about 1 in 2,000 people, or up to 1%, which is 1 in 100 people. That would be the fatality rate we would expect, learning from the Pacific, the Diamond Princess cruise ship. But again, that was early. That was out without some of the known treatments we have now. Known treatments like IV vitamin C or chloroquine, or a combination of chloroquine and azithromycin. This was the fatality rate before we came up with some possible treatments for this.
And from what I read, I think now I'm remembering, 20% of the passengers were infected.
Okay.
That was 20%. So even in a contained environment, you think this would be 100% of people getting it. Even in that environment, only 20% got it. And that 20% amounted to the 700 that were infected. Out of the 700 that were infected, again, this is a largely elderly population already. And that's what he's saying is you don't know whether, because it's more elderly, then the 7 that died is even higher than what would have happened in the general population. There's no way to really know that, but this is the only contained environment that you can really use to kind of estimate how out of control that particular virus was. But the same thing happened in China in the exposed populations. They were saying only 3% of people actually caught it. Just in the world, meaning not their entire country, but like in the areas that were exposed, only about 3% of people caught it. Out of then you have only small amounts that are, having the severe cases. I think people are right now thinking that if it's in your county, it's everywhere at every street corner, and if you're inside, you're going to get it.
And it's not.
But even if you're walking amongst people who have it in the regular busy public situation, only about 3 to 5% would likely catch it, even in a regular outdoor, or indoor environment.
And then if they're looking at, a case fatality rate of 1% or even less, 0.5% or even as low as 0.05%, he makes the point that we have had other respiratory viruses, including a variety of other coronaviruses, that have had case fatality rates as high as 8% when they infect elderly people in nursing homes. And in fact, he says that there are a whole variety of mild, quotes, coronaviruses that infect tens of millions of people every single year. And they account for about 5 to 10% of those hospitalized in the United States with lower respiratory tract infections each winter. And this has already been happening for many decades. This whole family of mild coronaviruses before this virus has been implicated in several thousand deaths every single year worldwide.
Okay,
Several
so
thousand.
to
Right.
clarify, this is not COVID-19.
Right. This is
but
all the other coronaviruses.
there's a family of
Right.
coronaviruses that have
Right.
existed long before that included things like SARS,
Yeah.
included things like the common cold and all the different strains. And so you'll see some studies coming up now where somebody tested positive 3 years ago for coronavirus, but that is part of the coronavirus family. It
Right.
doesn't mean it's COVID-19. And so they're responsible for the rhinoviruses and
Right.
and different types of respiratory infections that people get that can lead to death. And so he's using those numbers, to say basically 8%. We've had 8% fatality rates before from other members
some
of this
these
family
coronaviruses. Right.
that are not COVID-19.
Right.
And right now we're looking at 0.05% up to 1%, which is still, people might think those numbers are high because every time they hear 1%, they take that and apply it to our entire population. But just like I told you, it would be maybe about 3% of our entire population would even be exposed to it. And then out of that percentage, it would be the 0.05 or up to the 1% that could have fatality. But one of the things I think, before moving on further, that was really interesting, and I did a quick little graphic meme about this, but he is one of the first people that really took the time to talk about how we need to have a representative random sample of the general population to understand, again, what our denominator number is so we can calculate accurate fatality rates. Right now, all we know is who was sick, who the severe cases were. We don't know the hundreds of thousands of people, maybe in the millions of people that have had mild cases of this already, so that we could accurately calculate. So what he says is, he says, quote, "Reported case fatality rates cause horror and are meaningless.
Right.
Patients who have been tested for SARS-CoV-2, which is the technical name, are disproportionately those with severe symptoms and bad outcomes. As most health systems have limited testing capacity, the selection bias may be even worse." And he said, there is not a single country that has reliable data on the prevalence of the virus in the random sample of the general population. I just keep hearing this over and over and over. People don't seem to understand this concept. You cannot divide the number of deaths by the number of reported cases to get an accurate mortality ratio.
Right.
You have to know and have to have an idea, just like with influenza. They estimate about 50 million cases a year in the United States. So when they do their mortality data, they're taking the number of estimated deaths, which they estimate this season 20,000 to 50,000. And I think that makes up influenza and other respiratory viruses that cause pneumonia. They're taking that number and they're dividing it by 50 million, which is what gives you your very low 0.1% mortality rate for influenza. And what people are not doing as it relates to this is they're not using that same logic. They're taking the 500 deaths or whatever it is and dividing it by the case totals in the United States, and they're saying, oh my God, look at these fatality ratios. And then they're taking that number and applying it to our entire population, and they're waiting for 1 million people to die. And that's why they're yelling at the president saying we need a national lockdown. It needs to be stricter. We need to do this longer. People in the conference today and yesterday, the media were actually saying it's too soon. If you open the doors, it's going to be too soon. And we've had this 14 days of economic collapse, and they're saying it's going to be too soon because they're using numbers that are accurate, and they are thinking Armageddon. Like literally, there's going to be this, entire devastation of people dying left and right because if you walk outside your door, you're going to catch it, and if you catch it, you're going to die from it. This narrative that we're being told, people are so scared.
Right.
They're so scared. And I don't really blame people for being scared. I mean, you turn on the media, if that's what you hear, that's what you're going to think. But this is very complicated, and there's a lot of data. And I have just come across video after article with these experts from all over the world that are law professors, educational professors, medical doctors, specialists with respiratory conditions, scientific advisors. We've looked at all these different people, and they're all very educated, and this is their career. They've been in this for a long time, so I trust their opinions. And so many are saying the same things that we are saying. So if you happen to jump onto this feed because somebody told you to watch it and you disagree with us, you think we're not taking it seriously. I saw somebody's comment that was like, I hope Melissa Floyd sees this. I like her and Dr. Bob, but I think they're getting it wrong on this issue because she's buying into the fear narrative that's also being given. But I just don't think that tells the entire story, much like the vaccine debate. And so you have to understand, we're doing our due diligence. Like, we're literally looking through so much content. Not like we're just coming up with our own opinions. This is like other experts that do this for a living and just taking all that information and saying, okay, let's paint the picture of what seems plausible or likely, or where do I have questions, or what doesn't sit right with me. And so I hope that you guys that are even maybe on the fence of this can still appreciate the fact that we're bringing you expert information and we're trying to break it down and digest it, but it might not be the popular opinion and it might not be what you hear on the media. That's not to say it's false, and it's not to say we don't care about people that are injured or could be injured by something like this. So this is just another side of things, but these people have great information, great statistics, and they're talking about all the same things that we are and that we have previously.
Yeah, this Stanford professor says locking down the world may be totally irrational. And again, I think that initial lockdown really was because it was so unfamiliar. There's so much mystery and secrecy out of China. We didn't know what to do, so everyone just overreacted and locked everything down. And I guess again, what I see, most people now seem to be coming back from that and saying, no, this whole lockdown is not necessary. I mean, something I've seen our local hospitals and hospitals statewide doing when I'm getting emails from all the medical organizations that I'm part of, they're all basically saying all the hospitals are trying to prepare to take care of all the severely sick people. Everyone who does come down with that severe respiratory infection and needs to be in an ICU,
whether it's COVID-19 or something
or anything,
else.
right? Needs to be on a ventilator. They're basically expecting we might have a worse season now because COVID is adding on to the already number of infections that we're dealing with. So they don't want to be unprepared for that, and that's what I see all the hospitals doing. They're getting staff, they're getting equipment, they're converting like operating rooms into ICU beds. They're expanding their bed capacity. They're basically trying to get ready so that as COVID goes through our country, because it inevitably will, and as the very tiny minority, percentage of our population does become severely ill, the hospitals won't be overrun, and we'll be able to be prepared for this so that we don't have a high case fatality rate. But I feel like everyone seems to realize that we can't stop it. It's going to go through the population. It's going to be harmless for almost everybody. I think everyone seems to agree it is going to be mild and harmless for the vast majority. Let's be ready to treat the elderly when they're severely sick. Let's get prepared. So that's where I see all this preparation is going on. Is the hospitals want to be a place that can be ready to withstand this this outbreak, but I feel like as people agree with that, and the federal government's trying to make sure everyone's supplied with everything they need for that, everyone is also agreeing the rest of the country should be able to go on with life as normal. We should be able to, if you're going to practice social distancing, you're going to maybe quarantine the elderly. The rest of us who are healthy should be able to go back to our jobs, get the economy going as soon as possible, as our medical system, gears up, to treat everyone who's really sick. And that's kind of what I'm hoping that everyone's going to come away with, as soon as possible. It's not like, I feel like we do need to realize the hospitals have to get ready to possibly, care for a much higher number of severely ill people from a respiratory standpoint. Because if that does happen, and if it happens worse than we expect and we're not prepared, then a lot of people will be in a lot of trouble. But I totally agree with you that the whole rest of us, our country, we should just get back to life as normal.
Well, so two things on that too. I was looking up the data for influenza for last year, 2018, 2019, and I was looking in California. And what a lot of people don't realize is there was a second, almost as large as the first peak in March. So this is the time of year last year. That wasn't the case 2 years ago.
Right.
But last year there was a very sizable peak for influenza in March. So a lot of what we're seeing, remember, we've got 90 plus percent of people going in to get tested are not positive for coronavirus 19 or COVID-19, which means they're positive for something else. And that something else could be influenza, it could be something else. They could still need a respirator. They could still need assistance. They could still need that from a complication from that. Everybody's falsely thinking that if you're going to the hospital and needing help, then you've got this new coronavirus and it's so deadly these hospitals are packed.
Right, whereas the majority don't have the coronavirus.
The vast majority, they're like
right.
extremely high percents. And the second thing I want to say is I've had a lot of people that work in hospitals contacting me saying their hospitals are empty. So there may be these cases of certain cities where we've got the hospitals being overwhelmed, but there are also a lot of people where they said the nurses they're overpacked and they're actually encouraging them to take paid leave, that there are people sitting around with completely empty beds, floors with empty beds, that the picture that they're painting about hospitals being overburdened is not necessarily the reality.
Yeah, it's not the reality,
especially
yet. Yeah, and I think people are worried. I guess if coronavirus has been here for 3 months already, then you're right. There might not be this huge influx of severely ill people. I think people they're just trying to prepare for the worst and hope for something better than that.
Sure, but I mean, just realistically, how likely is it that it just got here just now?
Right. I think people are. It's unlikely. Right.
I mean, it's very unlikely, which means it's probably been here, and there's not going to necessarily be some huge flood, except all the people that are flooding the hospital that have these mild cases of things that are not coronavirus, and they're taking away the manpower and the supplies and the things by needing to be checked for something that they're being sent home and told to just be home.
Yeah.
In fact, the former head of the CDC was on a video that I was watching today, and he was saying when people show up to the hospitals, even if you're positive, they're going to tell you to go home and get better.
Right.
So they're not going to take you and admit you unless you're having severe respiratory distress. Right. So people are showing up by the flocks to the hospitals and they're negative. So then they're sent home. People are showing up, even the ones that are positive are sent home. So the hospitals aren't overrun with people from coronavirus that are having these mild cases, which is the majority. They're only going to be overburdened if they have the wrong people showing up, which is clogging their system, or if people have very severe cases. And we know for a fact that severe cases are so minimal, I don't really know how they could be overburdened in every major city across our country. I don't think it's going to turn out like that.
And I hope you're right. I hope they're not overburdened. But I guess everyone just wants to be prepared. They don't want to have all these sick people that need an ICU bed and it's not there.
But like you're saying, be prepared, but that doesn't mean send everybody home to not be at work.
I know, you're right.
I mean, we can be, just like President Trump was saying, we can do two things at once. We can be prepared. We can work on helping, build capacity at these hospitals that we have problems with. We can target certain areas, but that doesn't mean everything has to shut down. What we are seeing right now, to me, doesn't warrant the kind of action that they're taking. And I think most people are agreeing with that.
And most states are not taking that severe severe lockdown action.
I forget that not everybody is in this situation, because we are, and some people are talking about restaurants being open and things. Like that. I almost can't remember what that was
Going
like.
to a restaurant.
I mean, which is not the thing I'm missing. It's just the fact that being out and about is happening still in other places.
But I think, when this is all over, they this Stanford professor, he already talks about how every year mild coronaviruses already tragically kill several thousand people every year worldwide. That already happens, and we've already had a few thousand or several thousand die from this strain of coronavirus. He points out that every year in our whole country, or in the whole world, about 60 million people die from a whole variety of causes. That's the number he has, 60 million deaths from a whole variety of causes. Respiratory viruses don't even kill a million people. They don't even kill 100,000 people. They just kill several thousand people every year. Compare that to the 60 million that pass away every year from all causes. That's like a tiny little drop in the bucket. He says that basically the people that are going to die from this virus tragically are basically going to be lost as noise among the 60 million people that are going to die worldwide this year.
Well, and specifically how he breaks it down is he said, worst case scenario. Let's say, worst case, somewhere in the middle, we have this mortality rate that affects the entire population. He said it would translate to 10,000 deaths. He said on any given year, we know that respiratory viruses are killing 20 to 50,000. So here's the thing. I hear a lot of people go, well, you can't believe the CDC numbers about flu deaths. And this isn't about the flu. I think the numbers that the CDC give as it relates to pneumonia complications and influenza basically are like the family of respiratory viruses. So I believe those numbers are accurate. They're just not all influenza. And because we know, and he mentions in this article, only about 20% of lab cases this year have been positive for influenza. That means 80% of them are not. But these are people who are sick enough to be seeking a test at an urgent care or at the ER or their doctor's office to order a test because they are sick enough. And so 80% of those who are sick enough with severe symptoms, who think it's flu, not just like sniffles, are not even positive for the flu. And so we've got 80% that are not positive, just like, we're seeing the same thing with coronavirus. But he's saying 20 to 50,000 we know are in fact 100% dying of respiratory illnesses every single year. And I want you to know that includes children, it includes people in their teens, it includes people in their early 20s, their 30s, their 40s, and their 50s. It's not just the elderly. What I find so interesting about COVID-19 and its sister virus SARS is that it is not really getting at all. Fatalities are not getting to people under 50. Very rarely between 40 and 50, and almost nothing under that. I've never seen a virus like this, because even measles, we know, can kill children, rarely, but it does. This is such an odd virus that it basically targets mostly those over 60, especially over 70 and over 80. And so we know for a fact children and young people die every single year in the several hundreds of respiratory illness. We know that for a fact. So we're not seeing that at all, and we're still seeing this crazy panic because of the fear of death. But he's saying worst case scenario, it would be 10,000 deaths. That is still 1/5, 1/2 to 1/5 of what we see every single year by from respiratory illnesses.
Yeah, it's interesting is every year in the United States we have about 100 children die from the flu, influenza, confirmed influenza, about 100. Yet in China, they only have one confirmed child die from COVID-19.
Who's 14, and we don't know if he had.
Which is a very interesting discrepancy, and it just it speaks to the fact that we don't have to worry about our children.
But so the worst case, it's kind of good to know worst case scenario, I think, because he's saying that's worst case scenario is 10,000 deaths. Best case scenario, it's far less than that. The point is, this is happening every year, and nobody even stopped to think about it.
Right.
Nobody stopped to think about social distancing. Nobody stopped to think about taking the world off of their entire economic trajectory and stopping everything to save those handful of lives. I don't really understand, and I feel a lot of people feel the same way, why this took such a different turn. And obviously the more information as the weeks come in, we're going to look at how to deal with this, differently in the future.
Yeah. But he stresses, again, the Stanford professor stresses that we are not going to see an exponential increase in fatalities.
Right.
As the rates of this kind of follow a bell curve, and then they go up exponentially initially, it's going to flatten, it's going to go down. We're not going to see, what we're up to about, 450 deaths in the U.S. so far.
I didn't check today, but maybe 500, maybe 500, maybe even 600.
Right. But it's not going to be like 6,000 and then 60,000 and then 600,000. It's not going to go up exponentially. Viruses like this just don't cause that kind of fatality rise. And kind of his biggest point is because we have this absence of data, we really don't know. We don't have all the right data. We don't know at all if all these extreme measures of social distancing and lockdowns, we don't even know if it's going to work. We know we're going to cause harm to our whole country and the whole world with these lockdowns. and so he's saying that we're going overboard. What this whole approach with no data to show that this is going to be devastating to us as far as the virus goes, and no data to show that these lockdowns are even going to help. He says, why are we doing this? We shouldn't be taking such extreme measures in the absence of such data.
And this is a professor of medicine, a professor of epidemiology. So we're not talking about somebody who's just weighing in with his economic opinion, which is what everybody seems to think now, is that Trump opening up the country again is basically choosing money over people's lives. People are picking their 401ks, I've heard, over people dying. It's not like that. Like, we've got people that work in epidemiology that are saying this is not the right way to go. Right. People that are infectious disease specialists saying this is not the right way to go. And he talks about school closures, which has been a controversial measure. I looked at some data from the CDC today and some studies that talked about whether or not school closures have shown to be effective in the past. And they were studying influenza. And even that data was half and half. Some studies said yes, some studies said no. And influenza is a virus that actually affects children negatively, that you would actually see passed around a school and can have disastrous consequences. So what he says, what John says here, is he says this idea of school closures may actually backfire because children socialize anyway, right? And if they're now back in the homes with their elderly family members, if children being home disrupts parents' ability to work, and it also diminishes the chance of developing herd immunity in the age group that is actually spared from the serious disease. And so in many different ways, he's saying this idea of school closures have not been proven to be something that would be a type of government action that would make a difference in preventing transmission necessarily. I talked about the World Health Organization and how they said not a single case was transmitted in the China outbreak data. Not a single case went from a child to an adult. It was always the other way around. So people think, oh, what's the big difference of kids not being in school? Who's going to watch them? People have to lose their jobs to stay home to watch their children. So that is a last-ditch effort. That's something you're going to want to do at the very, very last measure. Yeah. And that's one of the first things they've done. And in California, they're basically estimating that would be all the way until September, which is months and months and months and months.
Yeah. Yeah, like speaking of experts, this article kind of has a link. You can check another article. There's someone who's a specialist in health analytics, and he's quoted as saying basically the novel coronavirus is a serious threat in that it can be serious for a very small minority of people. He says we need to prepare but not overreact. And I think that's the gist of what most people probably would agree with. I like that we're preparing, and I like that our hospital is preparing, but everything else is I feel like a significant overreaction, and that's going to again end up probably causing more harm than good, as the president is saying. He doesn't want the cure of this to be worse than the disease.
And so he also talks about flattening the curve. So we've heard this phrase, flattening the curve. And he said, flattening the curve to avoid overwhelming the health system is conceptually sound in theory. So this all makes sense in theory. But he says, yet if the health system does become overwhelmed, the majority of the extra deaths may not be due to the coronavirus, but to other common diseases and conditions such as heart attack, stroke, trauma, bleeding, things that are not adequately treated. He said, then flattening the curve may make things worse because instead of being overwhelmed during a short, acute phase, the health system will remain overwhelmed for a more protracted period. And we've heard also, as it relates to flattening the curve, I don't think this is something that people realize. It does not mean there will be less cases.
Right.
So that's one of the things people think we're going to flatten this curve, like we're going to stop some of the cases. It's literally stretching them out. You'll have the same number of people that are infected with this. And the idea is to keep it so that the hospital system's not overburdened at one time. It does not decrease. It's not going to decrease the number of cases and therefore might not decrease the number of deaths from coronavirus. It's just going to spread them out. People think everything we're doing right now is going to cut it off. It's going to stop it. The only thing it could help is people that might have otherwise not been seen by that hospital because they're
Right.
overwhelmed, but
Right.
that doesn't look likely based on the data that we're seeing.
Yeah, but I think if the flattening the curve theory, if it proves correct, and we basically have slowed the spread of this virus, but you're right, it's not going to ultimately decrease how many are affected. But if we've slowed the spread through some of these measures we're taking, and hospitals have time to prepare and have time to get all the right equipment, then as these severe cases come in, the hospitals will be able to handle them. And I guess, like, if we had done nothing, and if this did hit hard, then hospitals would possibly already be overwhelmed with more severe cases than they can handle. So that's, I guess,
But again,
that's what they were thinking
but that's the
when
theory.
it came.
That was
You're
the
right, it's
theory. They
theory,
were
right. And
projecting.
they might be right or wrong about it. It's hard to say.
Well, I don't know. In the conference with the president, he's sitting there going, "It was a learning experience. It's been a learning experience." To me, what that translates into, we realized we didn't have to do this much. We've
Yeah.
learned in the process, and now let's keep moving forward with kind of maybe stepping
Yeah.
back a little bit because it's too much.
Yeah.
I mean, I think I originally when I thought of flattening the curve, it seems like you're cutting a portion of it off. So you're losing all those cases you would have otherwise had.
Right.
Because you
but
see
you're
a curve,
not.
right? But
Yeah.
and that's why I'm explaining it is because you
Yeah.
see this like high bell curve, and then you see a lower one, and you think, look at the difference in number of cases.
Yeah.
But that's not how it works. You've got a short curve that's high, and then you have a long curve that's lower, but it equals the same amount of cases. You're not losing, and it talks about that in one of these other articles. I'll quote the guy.
Yeah, but then the point is, if you the problem with all this social distancing and locking down is, we said before, once you open everything up, if you just send everyone out of the world, then you could have this huge outbreak again because you didn't allow people to create some herd immunity, and especially if none of the kids are getting any immunity to this while they're young and healthy and able to withstand this, then they could be even reservoirs for more outbreaks of this if we're keeping them locked down for so long in the interim.
And so, as talking about the long-term locking down, he says one of the things that the bottom lines that we don't know is how long can we maintain without major consequences to the economy, society, and mental health. This is something that needs to be a big part of the conversation, and President Trump was talking about suicides and deaths that result from things like depression and suicides that come from economic loss. People are thinking you're taking the economic loss to save the lives. They don't understand that economic loss can translate into losing lives, and that that number can actually be much higher than the initial loss of lives from the virus. And you have to weigh that as a society. Not everybody gets to get saved. I mean, that's the reality of how life works. Viruses, illnesses, car accidents. There are things that happen all the time that we can't always stop somebody from dying. That's just not how nature works.
Mm-hmm.
We have to look at this cost benefit and say, for the handful of people that could die here, what about the hundreds of millions that are at risk of damage here? And these are difficult decisions to make, but it's just not so simple. You can't just say, well, some elderly are dying, so we've got to put the country on lockdown, and they're just going to pay your mortgage, and we'll all be fine. Like it doesn't work like that, because let's say you even got your mortgage paid. Let's say your bills were paid. The process of what's happening and the isolation associated with what's happening is going to have 100% going to have severe consequences on the mental health of millions of Americans, and that's just in our country. We've never done this before. I saw some articles shared about how people are having virtual dinners together so that they don't feel alone. And they're starting a hashtag called Alone Together. It's like they're trying to create this, like, this is a cool thing. We can be alone, but people need to be with people. Elderly need to be with people. They're being completely isolated now. We don't know how that's going to look for them, and being away from their family members and grandparents that don't get to see their own children and their grandkids. We don't know what this is going to look like. And so he says, everything is unpredictable at this point, and it could include financial crisis, unrest, civil strife, and a meltdown of the social fabric. So these are conversations we should be having about this issue, and this should be something we're discussing. That's never one of the questions you're really hearing at any of these governor or presidential conferences. All you tend to hear at these conferences is, why aren't we doing more? this should be stricter. There was somebody out at the beach yesterday. Aren't you going to do more? I mean, it's like you're not going to keep 330 million people inside their homes. There's absolutely no way to do it. They do not have the manpower to do it. And policing everybody to make sure they're not on some hiking trail is gotten out of control. Okay, it has gotten out of control. You have these people that are so super educated that are looking at this stuff saying, we are set up for a disastrous future if we follow this strict protocol and don't reevaluate. We need to reevaluate. You know, we've done what we've done, but let's reevaluate what's coming next. And he said, with lockdowns that take months, he said, these consequences are unknown and billions, not millions of lives may eventually be at stake. So he's saying billions of lives across the world are going to be at stake compared to the millions that may theoretically have been at risk for the virus. And these are the tough decisions that we have to make. And you know what? We have to look at all the sides of this before we're coming to our conclusions. And that's the thing I think most people are not doing right now, is they're not looking at more than one side. They're looking at one side, which is there are some people dying. That's all that matters. And, you know, death is an interesting thing. It comes in lots of different forms and it comes at different times. And death can be something that comes from economic strife. This is something that has to be considered. I read an article today that said that there were 10,000 suicides after the 2008 real estate market crash. 10,000. That was just one portion of the economy that was faltering at that time, and there was no isolation at that time. So you think about the social isolation element combined with the economic loss, combined with economic loss in every single area of our economy. This has never happened before. We cannot predict we are all going to be fine after this. So we should only be taking these strict measures if it is absolutely the only way, in my opinion. And if they went too far for it, let's reevaluate. Let's do it differently. Let's back off and fine tune the approach. That's how I feel about it.
Right. Yeah. So I'd love to do this article next. I found this fantastic article I think yesterday. So it's a brand new article. It's got some new ideas we haven't spoken about yet, and I learned some great stuff from this. I'm going to share it with you guys. And
every one of these photos is like somebody in like a hazmat suit. For every article on coronavirus. I know.
So we did put a link to the study we just talked about on our podcast page already on our website.
But we'll include it again.
Yeah, we'll include it again. But
the Stanford.
The Stanford study. So this study is called COVID-19. The science is clear. The best way to manage an outbreak is through identification, isolation, and quarantine. Experts agree. And I would add, targeted quarantine. And this was written by Tom Stavola, and Tom is he's part of an email chain that I've been with for a long time, and he is a biological science educator by training. He also has his MBA in business, so he understands business very well, and now he's actually getting his law degree. So he's very, very well educated person, very smart.
But is he a mom?
He's not a mom,
But
he loves data. He's kind of like the male version of you. Like he loves researching and looking at data, looking at studies, analyzing it, and putting it together in a way that makes sense. So
I like him already.
But yeah, I mean, he's not a medical doctor. He's not an epidemiologist, but he has a variety of training both in biology, education, business, and now law. And so he wrote this wonderful article just yesterday, just published yesterday, on Medium.com, and so again, I read you the title. You can find it yourself, but I just want to go through some of the main important points because I thought he was very very helpful to me in understanding this, and it kind of gave me a little piece about what's going on. One of his so basically, I wanted to he breaks down the possible mortality risk, all right? At the most, again, everyone's talking about mortality rate, fatality rate, or what it really is. He likes to look at South Korea as an example of one country that has not shut everything down. They're not on lockdown. They are social distancing. They're quarantining, they're identifying cases, testing everybody. And South Korea has probably tested the the biggest percentage of their population than any other countries. They have tons of tests done.
I think it's been 300,000.
Really? Yeah.
From what I
Wow.
heard,
It's amazing. Yeah. So he basically says out of the reported and actually known cases, South Korea has about a 1% case fatality rate out of known cases. All right. That's kind of the best data they can come up with.
I read originally 0.9% on that, and then Dr. Birx from the White House
Yeah.
mentioned South Korea yesterday and said 0.7, 0.8. So it might even be
Okay.
down even a little bit
Yeah,
lower.
it might have gone
but
down
it's
a little bit
definitely
lower.
low.
Yeah. Based on the only the identified cases, and we know there's way more than that.
Right.
But some of the things I learned from here is he talked about how do you catch coronavirus and how much is it airborne, and this is really important. Coronavirus is actually spread by respiratory droplets, like coughing and sneezing, the actual like snot or saliva that comes out of you. The virus is contained in those droplets, those liquid droplets, which fall to the floor very quickly. It doesn't stay in the air. So you actually have to be very close to somebody who coughs or sneezes and close to them right away if you're going to get the virus from them. It drops right to the air. Whereas measles, for example, if someone coughs or sneezes for measles, the virus particles stay suspended in the air for a very, very long time. But when you look at things like flu and whooping cough and COVID-19, they all are, their respiratory droplets fall to the ground very quickly. And so it's not actually easy to catch this virus through the air, through coughing and sneezing. Right. You have to be very close to somebody and close to somebody for quite a long time if you're going to catch this. So we can now be, and he shows the studies that talk about this. His article is very well researched, very well referenced. And so that kind of encouraged me. If I'm a doctor and I'm in someone's face, looking at them and they're coughing all over me, yeah, that's a risk to me. But not just being in the same room with somebody or walking through the same hallway or walking past somebody outside, for sure, is not the risk that I think the initial fear was that people were worried about.
Don't mind me, I'm looking up something to support what you're saying. Actually, I meant to tell you.
So you have to be very close to a symptomatic person if you're going to catch it through respiratory droplets. And then he also talks about, so all these things fall to the ground, so the virus will stay on surfaces. So if you're touching surfaces and then touching your eyes or touching your mouth, you can catch it that way as well, because that's how these respiratory droplets are passed. But he talks about a CDC study. So CDC already studied and published 445 close contacts of 10 people who were among the first confirmed cases in the US. All right. So the CDC, they got 10 patients in the US, all positive for COVID-19, and they studied the 445 people that came into contact with those 10 confirmed cases. And this is really good data. He said 4% of those 445 contacts were members of the patient's household, okay? Family members, household members of those 10 infected people. He said 23% were community members who spent at least 10 minutes within 6 feet of one of those confirmed cases. 22% were community members who were exposed to a patient in a healthcare setting, but they probably weren't very close to them. They were just in the same healthcare setting. And then 50% of these 445 exposed people were healthcare personnel, right, who were involved in the care, right? So they studied these 445 contacts. The data they came out with was amazing. So they monitored all these contacts for 14 days, and what they found was only 2 of those 445 contacts tested positive for COVID-19. Only 2 of them. So 10 patients, a bunch of contacts, family members, community members, and medical personnel. Only 2 people became positive.
What does it say? These 2 were household members.
Right. And those 2 people were household members, right? Which means the community members, the healthcare personnel, people who were who spent about 10 minutes within 6 feet of these. 100 people spent 10 minutes within 6 feet of these confirmed people. None of them became positive. what I thought was also interesting was um, two of the two people that were positive were household members, but there were five household members who had continuous contact with these 10 patients. Five household members did not test positive for the virus. So the take home message was basically it's very important to understand these CDC findings, and that one's chance of contracting COVID-19 is very low, even if you've had close contact with somebody.
Yeah, I think it's. I have something in here that says 10%. You have if it's somebody in your household, you have about a 10% risk, and that's in your household.
Yeah,
which is still very, very low.
Yeah, but all these community members walking
Right.
past someone on the street, even the healthcare personnel, none of those people test positive. So those are data on 445 exposed people to 10 confirmed patients.
Wait, just in addition to the airborne thing. So this is somebody from the health department that was basically writing a letter to their health staff. This is confidential, so I'm not reading any of the details on it. But they said, I've spoken to multiple people here at the health department, and they have defined, this has to do with they talked specifically to the CDC. They said they have defined the close contact that would be required for the virus to be transmitted. The person would have to have been closer than 6 feet to any person for longer than 10 minutes. This is the CDC definition of close contact. Even if you spoke to the person in passing in the hall or anything, you're very unlikely to transmit the illness. The analogy they gave me was this. Let's say an infected person was flying on an airplane and got sick. The CDC would only test the people in their row and the row behind and in front of them. The rest of the plane they would say was just fine. They also said the infected person very rarely sheds the illness before they have any symptoms. The health department actually only advised people to notify when they've been around somebody while sick. So not contact with person before they had symptoms, but while sick. So the other information he told me was that to ask people to quarantine for 14 days, but the vast majority of people show signs within 5 days. There were only a few outliers that showed symptoms at 14 days. And I keep hearing people talk about this. Oh, the virus can live within you for 14 days. That's why. But the reality is I think there have only been 1 or 2 cases that they documented that went that long. Everybody else is about 5 days.
Yeah.
And it said, ultimately, the protocol with the virus is anybody who's exposed can self-quarantine for 14 days if you were around somebody with actual symptoms. But that is just to be on the safe side. So this is like in an internal document, and I thought it was kind of nice because it sort of does clarify exactly what you were saying about the amount of distance. People think you're in a grocery store and you're going to come in there and come in contact with it, and that's going to be it for you.
Yeah.
And what they're saying is in the community, that's part of the reason why they can open the economy back up, is because of what you're saying. It's not airborne the way people think, and these cases are not being transmitted between community members with casual contact.
Right.
So that's important. That should make people feel at ease about the idea of opening the economy back up and getting things, people back to businesses.
Yeah. Great point.
I thought so.
Great point, Melissa. So he talked about some researchers in Singapore where they had a lot of hospitalized patients, and they tested the air in these patients' rooms. All of the air samples they tested revealed no viral particles in the air, even on the days the patients were symptomatic in their hospital rooms. They did find virus particles on the surfaces in the hospital rooms, but not in the air. And then a study at Wuhan University, they analyzed air samples at 2 hospitals, and they found no SARS-CoV-2 particles in the intensive care areas, no particles in the air of the hospital hallways, patient rooms, or outside the hospital. Again, they found virus particles on toilets and other surfaces, but not in any of the air samples.
And that's in the place with the sickest people.
Right. So again, that speaks to why we don't need these lockdowns, like you just said. This is one of the many reasons why all these strict lockdowns and extreme social distancing is unnecessary. So his bottom line on this is SARS-CoV-2 is not an airborne pathogen per the data that we have. The chance of contracting it through the air is extremely low. So then he talks about a couple of studies on surfaces. What they found so far in studies is that the CoV-2 particles will persist for less than 4 hours on copper, less than 24 hours on cardboard. It'll persist for about 1 to 2 days on stainless steel and as much as 3 days on plastic. So the virus will live on these surfaces, and that's why it's important to wash things and don't touch things and then touch your hands and your face, your eyes. But these things will die off. And contrasting this, 5 strains of influenza that they've tested will live for 2 weeks on stainless steel.
Right, so you might think 2 days, oh my God, that's so long, or a day, that's so
Right,
long.
but the flu can live for 2 weeks on stainless steel.
And from what I read about surfaces, showing the presence of the virus is not the same as having enough viral load in that
Right,
specimen
right.
to transfer to
Yeah.
somebody and actually cause an
Yeah.
illness in somebody.
Yeah, but it's
So-
funny. You see people wearing gloves. Cheryl was telling me this day. I saw we're driving home from work and we saw 2 kids playing on the street and they were both wearing gloves.
Oh, jeez.
And
Outside.
yeah, outside. Yeah, but it's funny. Like if you're wearing gloves and you're touching an infected surface and you touch your face,
Of
you're
course.
still gonna get it.
But that's
Wearing gloves doesn't do anything
it's the
for
same
you.
thing at the grocery store,
Right.
though, because people are touching with the gloves all these items
Yeah.
that have been in
So
the
wearing gloves
places.
makes no sense unless
Right.
you're like a healthcare worker. You're going to see a patient and,
And then
then
you
you're
take
going
them
to
off and-
take your
yeah.
gloves off and wash your hands.
Because
So
people go home with the same things
Yeah.
that they just touched
yeah,
everything
so
with. They threw their
don't wear
gloves away.
gloves.
but-
Don't wear gloves, people, unless you're a healthcare
Unless
worker.
you're outside playing.
Yes. Yeah. So then, so this author talks about asymptomatic people. Is there any risk? And he says there are no data indicating that a person can become ill by standing or sitting next to an asymptomatic person. No data. He says there was like one report, an anecdote in Germany where they thought this happened, and that's since been refuted. So as far as the data we have, there's no such thing as a contagious asymptomatic person who's going to infect people around them. It just doesn't happen based on the data they have. And he says the CDC confirms this on their website. I guess that's it. He talks about the origin of the virus a little bit and how when you look at the genetics of this virus, it really seems like it's hard to be able to say that this was a naturally occurring mutated virus. The kind of mutations this virus had speaks that it might have been somehow artificially mutated or manufactured in a way. He didn't go too much into it, but a lot of people are concerned that this was not like a natural occurring mutation based on the characteristics of this virus. But he didn't go much into that because that's not really the gist of this article. He asks, can people become reinfected? And what they did is he shows they've already done a study in monkeys. And it shows that in the monkey study that catching the virus induces immunity. And when they re-expose the monkeys a second time, the monkeys do not become infected again. They do not become ill or symptomatic again. So based on that study, they think it was a very small study. So you can't, make some great conclusions for it. But based on the one study they do have, they don't think you might be able to become reinfected. You had heard something about possibly somebody becoming reinfected.
Right.
But
I think from the other thing that I had heard was that in a study they found at least antibodies a year later in a similar
Right.
virus. So they think it's at least going to give you immunity for that long.
Right, okay.
We don't know if it's and probably in the monkey study
Okay.
they didn't study long enough to find out if it's longer than that. So they said
Right.
you are getting some immunity, obviously. But
So he talks about the different responses globally, and he highlights what we've learned based on the data we have. So he talks about South Korea, where they've tested the most people, the biggest proportion of the population than compared to any other country. He says South Korea is not doing extreme social distancing or extreme lockdowns or anything like that. South Korea is basically taking the most basic public health measures. They're identifying all the sick people, they're isolating all of them and quarantining them, and then they're sanitizing and disinfecting everything related to those cases. Those who break quarantines receive fines. And he says South Korea has so far succeeded in flattening their curve. And he says, while some people are staying home to work, businesses for the most part are carrying on as usual. And he says, based on the timing of when this was written, over 300,000 people in South Korea have been tested, and the total cases they found
I'm
are
gonna tell you that
right.
number, huh?
They're about is almost 9,000 cases. That means approximately 3% of those tested in South Korea are positive.
Right, and South
3%.
Korea is testing people that are random in the population now too. They're
Okay.
not only testing people that are infected and members that are close to those that are infected. They're testing random people also to get an idea of what the sample size is, which is
Yeah.
smart. And the UK is now in the next couple weeks going to be sending out tests that are going to be testing in those who have already recovered. They're going to be doing antibody tests for the population. The test that they have now is only for if you have symptoms. The one that we're all using, it's like this really severe nasal swab. Did you see how far that thing goes
Oh,
down?
I've done it. Yeah, I've done it
I've heard
for the
everybody
flu
cry.
and stuff.
Mm.
Yeah, I've done it myself. It burns.
Yeah,
like
God.
it's
So you have to have symptoms for that to show up. And so they're not able to test with what they have now. They're not testing people that could have had it a month ago or 2 months ago. But the UK is just about to do that in the next couple of weeks because they want to start sending people back to work and know who's had it and who's good.
Yeah.
And that's exactly what we should be doing in this country. We
Yeah.
should be finding out exactly how many people have already had it because I think people would be just blown away to find
Yeah.
out how big these numbers are and how they've gone about life just totally fine before they knew about it. Now that they know about it, everybody's hypersensitive and everybody's suspicious and everybody's suddenly
Yeah.
become a hypochondriac.
yeah.
It's the weirdest thing. Like I have a tickle in my throat. Like, oh my God, like
Yeah.
what is that? You know,
Yeah.
it's could be seasonal allergies, and yet people are assuming it's their death sentence, and they better rush down
Yeah.
to the hospital.
Yeah, well, he talks about that. He highlights kind of how that's going in Italy, where Italy's faring the worst of all these countries. And he says that Italy has instituted a nationwide lockdown, meaning stay at home except for essential trips. And they've still seen an exponential rise in
Right,
cases
I
over
heard
the
that
last
too.
2 weeks, despite the lockdown.
The
So the
cases did not go
lockdown,
down.
the lockdown has not been effective.
And I think in their case, they were thinking that that could be because people live in these families together,
Right,
and they're
yeah.
actually spreading it more now.
Oh, yeah, exactly. And then he's saying Italy is now instituting an even stricter lockdown. But he highlights the point you made a few days ago. 25% of people in Italy smoke.
Mm-hmm.
A lot of them men. They have a larger elderly population.
Right.
So he says on he says well, I'll skip that part. But what Italy's doing is not succeeding. All right. And what South
This
Korea
I just read today.
Yeah,
by the
yeah.
way.
Well, I can read it
We
here.
can do it
then.
on the next one because we have to
Okay,
break it
okay,
down.
all right.
It's really fascinating though, you guys. You will
But-
not believe it.
But you'll have to wait.
But we're not going to tell
Right.
you. No, but it's like if that's true, I just briefly read that right
Yeah.
before I came
Yeah.
today. If that's true, that's going to change the whole
If what we're
conversation
telling
on
you
this.
is not true.
If what we're not going to tell you, but what we know is true, it's going to change the entire
I can give them a
conversation.
teaser.
No,
here.
no, not even.
Well,
Just keyword Italy. Okay,
Right,
that's
okay.
all I'm going to say.
but I mean, is
Don't tell them. Don't even attempt to tell
okay.
them.
Okay. So he talks about Japan. Japan has also significantly flattened their curve, and like South Korea, Japanese businesses remain open, and the government has not instituted a lockdown. And so his point is,
Singapore too did not close schools.
okay.
Singapore was one of the
Oh,
ones. So
oh,
Hong Kong
cool.
did, Singapore did
Cool,
not,
right.
and they did not see a difference in the rate of infection
Right.
between those two countries, between the ones that closed their entire school system down versus the ones that didn't.
So the whole point is a full lockdown may not be necessary, might even be worse because it's not working where they're doing it, and the countries that are not doing lockdowns, that are keeping businesses open, like South Korea and Japan, they are faring well, faring better than Italy. So he says the ultimate key is identification, isolation, and quarantine of sick subjects. Moreover,
Of
cases
sick, ill,
yeah,
like
sick
people that are
subjects, yeah.
ill.
Cases may increase again after the residential lockdown is lifted,
Mm-hmm.
and the virus will continue to take its course through the population. So he says the critical question for the United States is what should we do? Given what we know, proven public health techniques, successes like in South Korea and Japan, failures
Oh.
in Italy, I know, and the dynamics, what we now know about the virus and how it's not easily airborne, it's not easily transmissible. Is it scientifically unwarranted to force a total shutdown of society, or is a middle ground, like I said, a few days ago, more narrowly tailored approach is that what's required?
Middle ground. It's
Yeah.
almost like we were on
I
an
know, I
episode
know.
called Middle Ground. Remember that?
Yeah, healthy asymptomatic individuals should not be kept from going to work or being out in the public because the long-term economic consequences could be very severe. He says, in the U.S. as of yesterday, his numbers are basically 35,000 currently confirmed infected. 98% are in mild condition. This is in the United States. 2% are serious or critical. We have about 450 deaths so far, which gives a case fatality rate of about 1% out of the confirmed cases.
But also,
right? But again, let me stress, 98% in mild condition, people.
okay, but can we just even address this whole deaths with COVID-19 versus deaths from COVID-19?
Oh yeah.
I've heard a lot of
I
medical
saw
professionals
some of that in
talking
discussing
about you may, and there have been cases of people with COVID-19 and influenza A, and if that person dies, they're going to say they died from coronavirus. But somebody could be positive for COVID-19 and have these other comorbidities.
Die of a heart attack.
And then they're going to be listed as dying from coronavirus. And so that's kind of we shouldn't tease anything. Okay, I'm not going to say it. But I have heard specifically medical professionals say the difference between dying with coronavirus and dying from coronavirus. They are not the same thing. So even with the deaths in the United States at 458, whatever that was at the time of that article, even those numbers, that is not necessarily saying every single one of those people died specifically from coronavirus. They were totally healthy before they got it and they died. So we have to, keep that in mind. We don't know all the other circumstances with that person.
Yeah, so he gives us a little reassurance.
You're so impatient.
Sorry, well, this is a good article.
Let me give it my next point.
Well, no, but...
Okay, so wait, Dr. Bob got to do his own article this time, and as you can tell, he's very excited. So when he told me about this article, you know what I chose to do, you guys? I chose not to open it.
Okay, yeah, well, no, so I texted it to her. I'm like, this is a really good article. But
you didn't even read it.
I know, but I'm like, but I haven't read it yet, but it looks really good. So she's like, so I think what you said, I
said, did you read it?
Yeah.
Like today, and you're like, I haven't yet, but I'll check it and see if it's good.
Then I remembered how busy you are, so I'm like, don't read it yet. Let me read it first.
No, you didn't say that.
And I'll tell you, I thought it.
No, okay, well, no, I wasn't going to read it anyway because I was super busy. But what I'm saying is I didn't open it on purpose just so that he could have this article to lead it and go through it. And so he's a little antsy. He's a little excited. God forbid we take a pause for a second. He's ready to hop back into his look at all these little X's and he you can't, oh my God, you can't see. Oh yeah, see highlighting and X's and stuff. You guys, this is what quarantine does to Dr. Bob.
Yes.
He's become an excited student. So just breathe, okay? You got your time, don't worry. Right. Nobody's going anywhere.
In Washington State, that was the first hard hit area of this outbreak. Washington State has reported very few new cases over recent days, indicating a significant slowing of the rate of increase.
Because it's a bell curve, again, and it drops.
Right. And he says Washington State did not institute a lockdown or stay-at-home order. They did close public gatherings, but according to the author, and I don't know for sure, but he says that they did not institute a strict stay-at-home or a lockdown. So again, his conclusion is narrowly tailored measures with identification, isolation, quarantine, disinfection, and then using therapeutics when someone is sick. Okay, so he kind of, let's see, there's this South Korean doctor that kind of gave us some information. Let's see, blah, blah, blah. All right. Well, he talks about those who are 70 years and older, and he really wants to stress this, that as we're doing all these other measures, identifying and quarantining, and he says we really do need to be careful with those who are 70 years of age and older, those who are significantly...
So people like you.
Right, I know. Those who are significantly immunosuppressed. We do have to exercise caution with them, and maybe they should remain at home, voluntarily.
Even after the economy opens back up. The idea that even after that point, you might want to take it a little more careful.
But he says we do not need to quarantine So I like this quote. We must identify, isolate, and quarantine sick people, not quarantine the entire population of mostly healthy people.
Okay,
And
when
they
you're
push-
reading a quote,
I know.
you have to make sure.
I know. But that's his whole point. We should not be quarantining an entire
I
population
know.
of healthy people. And in the case of Italy, stay-at-home orders could actually make things worse. The science has shown that community spread is not the issue with this
Right.
virus. So I just thought, I don't know, there's so many good scientific points in there that basically back up everything we've been saying and everything that so many medical professionals all over the world have been saying. And now that is good to kind of have all the science there in one article. And he has like, I think 30 or 40 references here that show you the studies that he was getting all these data from, so you can read them yourself if you want. But
How do you
again,
feel?
thank you.
How do you feel? How do you feel, Dr.
I
Rob?
feel good. I feel
I
good.
can tell.
No, but I mean, I feel better. I mean, I felt a little weird walking around the store, and I didn't want to get too close to people, and I, making sure if I heard anyone coughing, I wasn't going to go down that aisle. I guess honestly, I mean, now I can kind of feel a little bit less paranoid.
Wait, what if that aisle had gluten-free cookies though? Would you still? Would you still need?
Yeah, because they're
avoid it?
sugar-free too. Huh? Yeah,
Ah.
sugar-free. There's no sugar in gluten-free food, right?
But it's weird that the U.S. Surgeon General, I saw like a tweet by him where he's like, everybody just needs to assume they have the virus. And I'm like,
Yeah.
what a weird thing to ask everybody to
Yeah.
think. You're totally healthy. You're not sick, but pretend you are sick. Let's assume you're sick. All your kids are sick. Everybody's sick. Everywhere is sick, sick, sick.
That's crazy.
It's like, it's just a very weird thing to convince everybody that it's not safe to be around other people. It's not safe to be around your family members. The world is no longer safe. Every stranger's a potential risk. Like, what's this going to do to the way that we interact socially?
I mean, if this was a deadly disease for everybody, yeah. I mean, people would be treating each other like that.
Mm.
But yeah, to treat each other like that over a disease like this,
But most
it
people
seems
are
extreme.
Most people are
Yeah.
not sick with it.
I know.
Like the vast
I know. And now
majority.
we know you can't get sick from someone if they caught it but they don't have symptoms yet. If they're not coughing in your face, and if you're not rubbing your hands all over them or touching the surface that they just licked or coughed all over, you're not going to catch it.
And you're not
So-
going to be sick for 14 days and not know it.
Right,
This idea
right,
is
yeah.
absolutely
Yeah.
inaccurate.
So thanks, Tom. Stavola again. COVID-19. The science is clear. The best way to manage an outbreak is through identification, isolation, quarantine.
You are
So
way
you
too
find yourself.
excited
I know.
about doing your
I
own
just
article.
thought-
You're going to link it. It's
Right,
good. They'll
I will.
find it. So in alignment with what you're talking about, a lot
Mm-hmm.
of people watching this will already have looked at this article that I just want to bring a few points that go along with what you're saying. It was called Evidence Over Hysteria, and it was taken down from medium.com, which is where his is. But I eventually found it again. Somebody hosted it on their website. And it was a really long, very lengthy, like 50 pages long to print. So I only printed out what I really liked the best. But very interesting. A lot of what we've been saying, this was 3 or 4 days ago. So this guy was saying it way before anybody else was saying it, which I kind of liked. I don't know his background. He's like a data guy, but not in medicine, but a data guy. I think he works in Silicon Valley. And so anyway, he was just looking at the information, putting it all together one place. Stop trying to read my pages.
So what's fascinating about
here.
this story is
That's what you would do.
according to the data,
You'd be like the highlighted parts. And this graph is really showing everyone.
and the
about-
conclusion, the take-home
The app-
message.
How dare you? Anything with my stars next to it.
I did that once on the podcast,
Oh,
and only
God.
once. I've never done that again. Right?
Terrible, terrible.
What kind of graph
So-
is that?
So don't look. So stop looking. So he's one of the first people that really reminds everybody that the way viruses work, they work on a bell curve. And I know that's something you might have heard from Dr. Bricks from the White House briefings, but it's important to understand that because people keep thinking it's going to go up in that linear curve like we talked about the other day. And so he said, beware. What are you doing?
I was
Okay.
just looking at the camera, not at your face.
You checking yourself
I know,
out? It says, beware of believing the metrics that cases are doubling. When they say cases are doubling, because usually these are small numbers in small areas. So you could have 4 cases and they're doubling, now they're 8 cases. So it makes it seem like, cases are doubling, makes it sound like it is exponentially growing and it's going to go out of control. And we're just at the beginning of what's going to be awful. but it could be a small number of cases. And when they doubled, it's still a small number of cases. Remember, I talked about that in the testimony for 277 in the assembly about the way that they're distorting the data, and you need to be careful when you watch it. So he's saying viruses don't grow indefinitely forever and ever. That's not how viruses work. They will always come down. And he says they usually drop on a steep decline the same way as they come up on a steep incline. But they are always on a bell curve. And that's a pattern that viruses always tend to follow. And it's a dominant trait of outbreaks, and they don't go on forever and ever, and they accelerate, plateau, and then they decline. This is represented in Farr's law, if you want to go into some scientific background. And so he's the one that talks about in both scenarios, whether you have the high curve, stop looking at my papers. You're like the person that is cheating on a test. Stop it. Look this way. Okay, so.
I'm glad you guys can see what I have to deal with all the time.
So he's the one that's saying if you have a sharp, I saw that. You're looking down the paper. Again, you didn't even realize you're doing that. If you have this high bell, I knew we were being serious for far too long that whole time. I was like, wow, we're being very serious for a long time.
Serious about
it was about to come out. So the steep bell curve like this versus the flattened curve like I talked about earlier, he talked about this is the same number of COVID-19 cases. And he said, unfortunately, when they talk about flattening the curve, they're actually not including all the other downside risks or the costs of implementing this. It's ignoring the idea of an economic shock to our system, which is something we always have to pay attention to. Okay, so here's something really interesting. Dr. Paul Auwaerter.
Can we read it too and then see if I can pronounce it? Oh, I don't know.
I want to say Atwater, but that's not his name. But Auwaerter. Anyway, Dr. Paul is the clinical director for the Division of Infectious Diseases at Johns Hopkins University School of Medicine. And he said, if you have a COVID patient in your household, your risk of developing the infection is about 10%. This is where I got that from. Right. If you have a member in your actual household living with you, you still only have a 10% chance of getting it. It's if you were casually exposed to the virus in a workplace with someone that was infected, your chance is about 0.5%. Wow. So 1/2 of 1% is your chance of being casually infected. That means 99.5. I was going to say 95. 99.5% of the time, you are not going to get it, even if you're around somebody that has it. We're talking about somebody who has it. You're still not going to get it. And then, interestingly enough, Maria van Kerkhove from the World Health Organization talked about how in the airborne thing, so the virus is not circulating in the community, even in the highest incidence in China. The community spread was transmission, where people were in this human to human direct contact, and the Chinese data does not show that there's any way to trace anything back to community spread. It was not common. And that's important to understand, because that's the reason everybody's afraid to go out in the world and why they're trying to say we have to have lockdown. So if they're showing that's not the way that it's spread, then it doesn't make sense why we still have. Stop looking at my pages. As it relates to the asymptomatic carriers, this is important because this concept of children being silent carriers and children being asymptomatic, and so you don't really get it, but they're holding this lethal disease, just waiting for these elderly grandparents to unleash it. It's kind of like the same concept of healthy, unvaccinated children that have all these other diseases in their back pocket, and they don't. So what they're saying about asymptomatic transmission, and this is what really has been bothering me about this, is people assume that means they had no symptoms at all. And what even Dr. Burke said is people that think they have no symptoms, like as in they're not severely bedridden, they have symptoms. They had a slight fever, they had a slight sore throat. There were things that led them, but we're so used to, like you're saying, with common colds, you're so used to downplaying that and still going about your life, which is where the danger comes, because we're now learning, people are not learning how to keep themselves when they're sick away from other people. It's not that the healthy people are at risk of transmitting this to somebody else because they don't even have it. Now everybody assumes everybody has it everywhere. But so it says they've had these different studies about asymptomatic carriers with this, and said the World Health Organization says only 1.2% of confirmed cases were asymptomatic. That's confirmed cases. And it says it's important to note there's a difference between never showing symptoms and being pre-symptomatic or mildly symptomatic. And the media is promoting this narrative that is unproven. It said almost all people end up in the camp of having mild symptoms if they're asymptomatic, in the way that the media says, within 5 days. It's never you have no symptoms at all. And I think it said it's very unlikely for individuals with COVID-19 to never show symptoms. So please don't think that the person who looks healthy, that was your cashier at your grocery store, is secretly harboring this, because that's what they're trying to get everybody to think. And this is why I wonder, how is everybody going to assimilate back into the world again? Everybody they're going to look at is going to be a potential risk or danger or suspicion, which is, to me, that concerns me. He brings up this point about airline staff, which I find really interesting. Airline staff being in a contained environment would be the most likely, next to healthcare workers, to be infected with something like this over the last couple of months. But what they have found is only a handful of people have actually tested positive. And so that is just more and more proof that you have to have direct contact, because these workers were not wearing masks. They were not using gloves. And this was before all this happened. Airline staff, they were still not testing positive. So that means they were not with a closed environment. We're talking about an airplane with a circulation system. They were still not testing positive. And so, let's see. Also, the declining fatality rate. I didn't even quite realize this. As you see the number of cases increasing, people assume the number of deaths are increasing also. But what they're not paying attention to is the fatality rate, again, incorrectly calculated based just on confirmed cases, but still, that fatality rate that they're giving us has steadily declined every single day. So even though the number of deaths is going up, even though the number of cases is going up, the rate at which the total cases compared to the number of deaths is decreasing. And so we originally started off with the United States with 4.06. This was March 8th. And by March 20th, that was down to 1.32. So that had gone consecutive days that had been decreasing. So that's something to pay attention to also. Are you looking at my papers? Stop it. What else? I mentioned in Singapore, they did not close the schools. Hong Kong did. And they did not see a difference in the spread of the disease or the infection between the two. So there really is not enough proof to say that closing our entire school system is doing anything to stop the spread specifically of COVID-19. And he suggests we should open up public spaces, saying shuttering the local economy is not only annoying millions, but bankrupting hundreds of businesses. The data is overwhelming at this point that community-based spread and airborne transmission is not a threat. I'm going to repeat that. The data is overwhelming at this point that community-based spread and airborne transmission is not a threat. And it says evidence from South Korea and Singapore show us it is completely possible and preferred to continue on with life while making accommodations with this tailored identifying cases and quarantining. And it says, with businesses, there are too many people the working population has been continuously impacted because having to stay home and care for their children now that schools have been out is stopping people from even from essential businesses, from being able to do their work, including healthcare. There are healthcare workers that have not been able to go to work because they don't have somebody watching their children. So that's something to think about as well. And this was called evidence over hysteria. And so the last point on this that I want to bring up, see how much faster I go through my articles? So the CDC is giving a worst case scenario of half of the country getting this, which would be 50 to 60% of our country getting it, which is 150 to 200 million people. Okay, that's their worst case scenario. So, am I boring?
No.
Everybody that knows me knows how I feel about people yawning when they're next to me. So, China's infection rate compared to their population and them being exposed was 0.006% of their population.
Whoa,
0.006.
seriously?
The CDC is estimating for the United States that we're going to have more than 30% of our population. And based on data we've seen in other countries, it did not happen that way. Even on a cruise ship that was contained only 20%, and that was a cruise ship, not open air environments. So half of our country is not going to get this. I looked at data with influenza. Every year, 5% of the population is getting it. 5%. And the way that you hear about flu season is it's everywhere. So that's 95% of people are not catching the flu every single year. Okay, so think about that. We are not going to have our entire population or half of our population catching coronavirus either. So this is called Evidence Over Hysteria. It's a really long but really good article. I will find the new link to add it to our podcast on this.
Is that the Johns Hopkins guy?
No, this is the data.
Oh,
the data
okay,
analyst
yeah,
guy.
yeah. Sorry. Right.
But everything is cited to reference other studies that I had already been looking at already.
Yeah,
Did you have the to finish off with this one?
I do, yeah.
Good.
Yeah.
Okay, so why don't we finish off with our last article, because I know this is a lot of information and we've been going for a while already, and we'll try to go through this quickly. This is from the New York Times saying, is our fight against coronavirus worse than the disease? Now, this is the one that's the director of the Yale Institute, because you had referenced Yale last time, talking about the experts.
Yeah, so this is the Dr. Katz, and he's the founding director of the Yale Griffin Prevention Research Center. So again, somebody who has
What's the first thing you picked?
has the qualifications for speaking out about this.
As everybody that we have shared also does, which is why we share them, because we don't just pick random thoughts here.
Exactly.
We're picking well-sourced, data-driven information the same way we do things.
Well, you circled way more things than I did. Right?
Well, here's something I thought that was interesting about this article. This is the New York Times, remember, which is tends to be very liberal on the vaccine issue and very pro-mandate. So it was interesting to hear this perspective. I was pleased that they were so open in what they were sharing. But he's talking about, stop looking at my camera, just listen.
I think you're just might have to accept the fact that I'm going to look at your paper. Okay.
That's like you. We're already in our 14 days. We might as well accept it. You're like one of those people, huh? It's just, well, we're here. We can't do anything about it, so we might as well accept it.
Stop trying to change me.
Don't change me. Okay, so it says, if a germ can't secure its hold on your body no longer serves as a vector and sends it forward to the next host. This is true even if that next person is not yet immune. When enough of us represent such dead ends for viral transmission, spread through the population is blunted and it's eventually terminated. This is called herd immunity. Okay, so this is a description of herd immunity, how it works. The germ has to move on to an available host, but what happens is once you get it, that germ is not able to replicate in a way that goes on to another host, even if that person is not immune. And this is how we blunt the spread of infection. This is partially why, like we said on our last live, the UK chief scientific advisor was hypothesizing that the population catching it and developing herd immunity was the best way to go. And the Netherlands has also adopted that policy, by the way. Mm-hmm. This idea that maybe we need this to happen because this is the only way that we can blunt this and eventually terminate this. Right. This is herd immunity.
Yeah, but the UK ended up not adopting that.
They did not totally. They kind of did a half version, I'd say. But the Netherlands did, and I want to look more into that. Mm-hmm. Yeah. So it just said basically that coronavirus actually has a good potential to use the herd immunity approach compared to other things. And part of the reason is because it doesn't affect children. Yeah. Because there are not fatality rates, you cannot quarantine adults and the elderly and quarantine young children because there are parents of those young children that are interacting with them and could not separate themselves. You can quarantine the elderly. And so they're saying this virus actually is a unique opportunity where we could implement herd immunity model on this and not have devastating effects like we would with almost any other virus, which I thought was kind of interesting. Yeah.
He just reiterates what we've read before about South Korea, where he says 99% of active cases are mild and do not require medical treatment. Most who got sick were 60 and older. Says that those who are 70 and older appeared to be 3 times the mortality risk as those who are 60 to 70.
And then
Right.
in the next,
And those who are 80 or older had nearly twice the mortality risk of those who are 70. Right. So it shows that the mortality rate goes way up with each
It keeps
kind of succeeding
compounding.
decade, 60 on up.
And so here's where he says the South Korea promptly started testing even apparently healthy population at large to find the mild and asymptomatic cases that other countries were overlooking. This is how they were able to do that widespread testing to find out more about how many people had it.
Yeah.
And we already talked about the cruise line.
Yeah.
And this is where it says influenza hits children hard too. So that's actually not an easy virus to do this herd immunity approach, because you cannot, isolate and stay away from children. But in this case, I mean, I've never seen a virus that does not go after people under 50. And you'll get people on social media saying this isn't true. I have a friend who's young and they died from this, or a friend who's young and they got it. And there may be outliers, there are going to be exceptions to the rule, but by and large, every country's data and all the data on SARS, from years and years ago, is still showing us the same thing, which is this is a very unique virus. The fact that the coronavirus family is not very fatal for young people is, it's just, that's the characteristic data of these family of viruses, this family of virus. So this is, you might hear the occasional story. Yes, there might be a child, there might be a teen, there might be a young person, there might be a handful of young people in a hospital. But overall, by and large, this is absolutely 100% affecting elderly, and not just healthy elderly, but elderly with underlying health conditions. So they're saying herd immunity this might be the ultimate opportunity to actually use this model. What was next that you had?
Yeah.
Same thing.
It's interesting that this article is filled with all the things we've been saying before from other articles, and this is from a Yale professor. So I'm almost not sure if we even need to repeat.
Well, this is a good quote. It says, "I'm deeply concerned that the social, economic, and public health consequences of this near total meltdown of normal life, schools and businesses closed, gatherings banned, will be long-lasting and calamitous, possibly graver than the direct toll of the virus itself."
Right, and that seems to be what President Trump is now saying as well.
Right, and he says the unemployment, impoverishment, and despair likely to result will be public health scourges of the first order. So like you're saying, this is going to come back around to health, come back around to science and medicine, come back around to potentially deaths and poor health outcomes, which was the original reason we're doing all this, was to prevent that. And the way that we're treating it is actually going to bring us right back around to that, and most likely much greater numbers and for a much longer period of time.
Yeah.
What else did you like?
Yeah, so
Anything?
Well, he said he's concerned that if we do succeed in slowing down coronavirus, then he asks, when does the society-wide disruption end? He's concerned if it goes on and on and on. What if getting back to normal life is like a year or more away? What if it goes to the extreme? The costs, not just in money, are staggering to contemplate. He says, we just don't know what this is going to do to us, and he probably agrees with what we've been saying, is that this all potentially could do way more harm than the good we're doing.
Well, and he goes into the questions I think everybody else wants to know. When is it safe for kids to go back to school then? When is it safe for teachers that have chronic conditions to go back to school? When is it safe for the workforce to go back? When is it safe to go visit your grandparents again? There are no real details here. Everybody's going to be afraid. Everybody's going to be scared. I think it's going to change the way we interact with each other for many, many months, and not just in a hygiene, self-conscious way, but in a damaging way, in a way that we are now staying away from each other. What does that look like as it relates to depression and other mental health issues down the line? We need, as a society, social interaction. We need our friends, we need our family, we need community, especially when we're struggling with things like vaccine mandates in our state for our children that are injured already, that are being discriminated against. Can you imagine not having your community to rely on as a support system during something like that? How are we going to get back to life as normal, as what normal used to be, without thinking everybody is a danger, and then we're going to instead choose not to interact, not to go out in the world? So again, we're not really opening businesses back up because they're still going to have a really hard time getting back to the numbers that they had before. This is going to take months for people to feel like they can go to movies and can go to concerts. Like, people are not going to want to do that even if they're allowed, because they're going to feel that hesitation, just like you said about being in a grocery store, hearing somebody cough. Even you, who's exposed to people all day long, is still, it gets in there. It gets in there in a way that affects us. And so, nobody's answering those questions. If the president says we can open things back up, and our governor listens, let's just say, how does that work, and how are they going to even come up with guidelines for like when certain things are okay and not okay? And do you think everybody's going to feel like they can go back to normal, or how long is that really going to take? I mean, there's an emotional side to this too. It's not just about the economic. There's an emotional side of reassimilating kind of back into the world. I mean, it's weird right now when you see people together, even in a group of 2, 3, 4, 5 people. It's like you're waiting for somebody to like look around and say that that's wrong, or you shouldn't be doing that. Or, I mean, it's unreal, kind of the place that we've gotten to with all of this. I wonder how long it's going to take us to get back.
Yeah, I found Cheryl and I took a walk on the beach today. I did find myself observing other groups of people.
Yeah.
And like we walked by these 6 teenagers that were hanging out way too close together. And I thought to myself, like, oh, that's interesting. But then what you said to me, like, I saw a parent and their child walking by, and I remember what you said to me the other day. And so I totally like looked at them and smiled at them, and just tried to I didn't say hi, but I just looked and smiled. And I don't know, but no, I totally find myself wondering about all the people that are walking around. What are they thinking? Not why are they there, but like, what are they thinking? Are they worried? What do they think about me? Are they looking at me funny? Are they like, we're trying to walk past somebody like on the beach, and are they like taking sort of a wide curve around me? Are they walking right past me? I kept noticing everyone's individual types of behaviors, and
it's almost suspicious though. It's not in a calm way. It's almost like you're dissecting and analyzing, and you're really laid back. So Bobby Kennedy's wife, Cheryl Hines, she was, I follow her Instagram because she's so funny. She posted a video of their season wrap party that was from last year, but she posted it and she says it's last year, but a lot of times on Instagram, you don't read the text. And so to see that many people together in a video, I'm telling you, it was weird. And she wrote back to me and even said, that's why I posted it, because it's weird looking at it now. A group of maybe 30 or 40 people all getting together for a group photo for the last, just seeing people together. There were people commenting on there, you guys are standing too closely together. And they were serious because they thought it was new. Wow. And I'm thinking, this is going to be the new normal. It's going to be odd to see people together. I mean, obviously, eventually that'll go away, but I wonder how long that's going to be. Because even I, as I saw that video, I was like, oh my God, that's a lot of people together. And you're thinking that's never a thought that would have come into my mind ever in my life before this happened. And I feel like this is going to change the way everybody looks at it.
And I worry that it's permanent. I worry that kind of psyche and this is going to be permanent. So I got to pull myself out of it.
Yeah, snap out of it.
Yeah,
Dr.
I know,
Bob.
as fast as we can. Yeah. Okay. Let's see. So I mean,
we've covered some of that stuff.
Yeah. I mean, he talks about. Let's see. Well, I don't know what else is interesting. Anything?
I mean, all this stuff actually, we actually have already talked about.
Yeah, I mean, he just says healthy people should return to jobs and school, and theaters and restaurants can reopen. Can reopen. He again is advocating. This Yale professor is advocating for a targeted approach to help protect the most vulnerable. Use appropriate measures. Don't overwhelm the healthcare system. Everything we've already been saying, but just coming from a Yale professor.
And you can. Low battery.
Okay.
Sorry, low battery, guys. So anyway.
Oh well, no. But what he says, a pivot right now from trying to protect all people to just focusing on the most vulnerable remains entirely plausible. But with each passing day, this kind of shift becomes more difficult.
And this was 3 days ago.
Right, right. And so that's why I'm really glad to see that the president is already talking about trying to shift
Give a
away
date.
from this and not give an actual date, but saying that that's what
Well, just
he's
mentioning Easter is
hoping,
hopeful,
yeah,
right?
hoping to move towards, because again, I think he's right. And then we continue to take the targeted measures, and meanwhile, our hospitals are ready for, for the sick people that they do encounter.
And they don't have mild people taking up space
Yes.
there that can
Yeah.
convalesce at home, which is something people just don't feel comfortable doing anymore.
Are we out of articles?
No, I mean, well, no, I had this other stuff that had some data, but I think you guys have had enough. It's been
Have
an
you?
hour and
Tell
40
us
minutes.
if you've had enough.
I don't even know. Can people even comment? I
Yeah,
mean, they're not-
they've been commenting.
but it's not like
I know, but
Facebook
I've been
Live.
reading your comments as you
Oh my
guys
God,
have
you
posted
can
them.
see
Yeah,
that
I can see
far?
that. Yeah,
Whoa.
yeah. You can see.
Amazing. With superpowers. Okay, so an hour and 40 I think is
Yeah.
plenty of time for people
Sure.
to talk about this. I'm sure you guys have been looking through every article on your Facebook pages and Instagram pages, and it's overwhelming. There's a lot of information. There's so many things to read. Even I probably need an internet break tomorrow because I have just been in deep research mode for the last couple of days. We will post the links to these
Mhm.
on our podcast information summary of the episodes.
Yes, on our website, there's a podcast tab.
And our website.
Yeah, and you'll see. I'm not doing them on Facebook anymore. I'm just doing it on the website.
No, but I mean, if they go to
Right.
iTunes and they're listening to our podcast, in the description,
Yeah.
they'll have the link to take.
Yeah,
them.
yeah. So on our website podcast tab, you'll scroll down to the very end because it's all in order. You'll see all the links to every article we've done on coronavirus so far. So.
And I don't feel like we were very entertaining today, so I apologize. I feel like we were really boring, in fact.
But for me, a lot of this was new information, especially I mean just new ideas, new information. So I love learning this, and I feel better I feel better about the medical situation. I feel continually concerned about the situation in our countries and the overreaction to this in our state, and hopefully wiser minds will prevail.
And I hope that we can access this stream later and see comments and maybe write back, because I haven't been able to, I can't write back to these after on Facebook since this is not on Facebook. But we will, we're also recording it, so we'll
No way, that was epic. So SV liked it. Thanks, SV.
we're gonna make some little video clips of this that I will put up on my Facebook page as well, and look at as it's dwindling down. People are saying good night. Okay, well, so anyway, thanks for joining in. So sorry that we went later because we started later, and so sorry that we were not on the platforms that you were prepared for us to be on. That was not our fault. We will try again next time for Facebook Live and Instagram. If not, we now have an option with YouTube streaming that works really well. And thank you guys for listening, and thank you listeners for tuning in on the vaccine conversation with Melissa and Dr. Bob. And we'll see you next time. And we'll see you guys next time. I don't know when that's going to be, but in the next, I don't know, 3 or 4 days maybe, we'll see if there's a bunch of new data that we need to
you
bring
want
to
to do
you.
this at your house next time?
I don't have like a cool background, and I have children sleeping, but it's possible.
Well,
sure,
we'll see.
We'll see. Anyway, you guys, take care. If you have things you want us to talk about or articles you think that would really be worth breaking down on this, that have some really excellent data that maybe you've come across, contact me on Facebook or Dr. Bob on Instagram and send it to us.
Her.
Contact him specifically because he's got nothing to do right now and I'm overloaded. Okay, anyway, thank you, and we will see
you guys.
See you then.
How do you
Press off.
let's say press stop.
And the X on the top right.
Are you sure you want to
Yes.
stop streaming?